But yeah, just talking about vehicles, my truck is 26, 27 years old,
Oh, wow.
1,000 miles. So yeah, it's
Hi, everyone. Just to let you know, now we're participants are joining in and they can hear us. So
thank you. Thank you.
Yeah. Hello, everyone. Welcome to our webinar. It's a pleasure to have you here. Today, we have our Model Aquatic Health Code Network webinar. In this month's topic, we'll be covering how to put the MAHC into action at the local and regional level. We have a featured guest speaker, Dewey Case. He's joining us today, and we'll introduce him in a minute. Just before we started, a few logistical items here. You can listen to today's webinar either via your computer speakers, or you can dial in the numbers here on your screen and the webinar ID if you rather listen through your phone. In the webinar, you are all muted, so I will ask you to please submit your questions either via our chat box or our Q&A box. My name is Daisy Galan. I am a senior program analyst here at NATO, and I coordinate our Model Aquatic Health Code Network. We hope you're a part of our network, and if you're not, at the end of today's webinar, I will have more information how you can join and how you can receive information about our upcoming webinars. So with that, I would like to pass the word to Christy Riester. She's the Executive Director of the Council of the Model Aquatic Health Code. She will be providing some announcements and then introducing today's speakers.
Hi, everybody. Good morning, and I guess good afternoon from wherever you might be listening from. We have a really great webinar coming up today from our new technical director, Dewey Case. He joined the CMAQ with us just last month. He has more than 20 years of experience in the aquatics industry and has participated with us for several years through different committees and programs. So we are so happy to have him on board. He has just jumped in and has really kind of hit the ground running. So we're really excited to have him, and he'll be speaking in just a minute. I do want to let any of you know, anyone who might be traveling to Texas next week for the Association of Aquatics Professionals conference. I will be speaking. I'll be doing a session on drowning prevention on Tuesday, the 17th. So if anyone will be there for that, please, oh, I'm sorry, it's Tuesday the 18th. I apologize. So if anyone is there for the conference, it would be great to meet you and have you attend the session. So with that, I will pass it on to Dewey.
Great. Thank you, Christy. Let me get, oh, everything pulled up. Okay, there we go. So I'm very, very glad to be here and speaking with NACHO, both in my role with my local YMCA and also as the technical director. One thing I do want to make clear is that today's presentation is purely my perspectives and kind of the standard disclaimer. It's not representative of YMCA of the USA. So I've been with the Y for 17, 18 years out of my career. And I've had an opportunity to work at a variety of different levels, obviously locally and regionally, and also serving with YUSA. And it's been an honor and a privilege to do that. And it's given me some interesting insights, especially as we look at the MAHC and how the MAHC has influenced not only the aquatics industry in general, but also the Y specifically. So the question is, how has the MAHC influenced YUSA? We'll start at the national level first. The Y, over the last 6, 7, 10 years, has updated its aquatic safety guidelines. These guidelines have been a long-standing set of practices that have guided and aided the operations of Y pools across the country for quite a long time. In the late 2000s, we recognized that this was a dated document that needed updating. So a committee was put together to update those guidelines. Now, one thing to keep in mind is with the nature of YUSA and having to, for lack of a better word, distance itself from daily operations for risk aspects to where a drowning at, say, my YMCA does not negatively impact YUSA, the aquatic safety guidelines are non-binding. There are a series of best practices put together by an excellent team of professionals. Full disclosure, I was the volunteer project lead, and I was very happy to work with the quality individuals that we had for these guidelines. But they are non-binding, but they do represent a set of best practices. Throughout the entire development of the aquatic safety guidelines, we knew the MAHC was a player. When we first revised these in 2011, we knew the MAHC was coming out. At that point, the first edition, I don't believe, had been released yet. Or if it has, it was just on the scene. And we knew this was going to have a major impact. So we started looking at ways to incorporate the MAHC into these best practices. And in trying not to create a massive document, we obviously referred to local code in the day-to-day pool operations with water chemistry, but we specifically referenced the MAHC with regards to its safety plan. So we actually have references in the aquatic safety guidelines that Ys should develop a safety plan in accordance with the Model Aquatic Health Code. And since we put in that best practice, we've had some pretty radical changes in YUSA. In 2017, the YUSA proposed, after a survey of its CEOs, an 11th membership standard. What we realized is we needed to improve our safety practices. There was a massive focus in this on child abuse prevention to reduce the exposure and risk that children have to predators and those type exposures in our YMCAs, but also strengthening our aquatic safety practices to reduce drownings. So as part of this, we have a couple of different things that happen. One is we require lifeguards to be certified, trained, tested, and deployed anytime a Y-owned or operated pool is in use. So as a public health official, the big thing to remember is there is no time where a Y pool should ever not have a lifeguard dedicated to providing supervision. So this includes swim practices. This includes any time that someone may be using. Also in this 11th membership standard, it specified that states that do not have bathing codes are required to follow the MAHC. Now, with that standard, we were specifically looking at Mississippi and Alabama, as these two states in my region do not have any codes at all. In Mississippi, we have a little bit of unique things in that we do refer to the MAHC, but it's not codified by the state legislature. In Alabama, only two counties rather, have bathing codes. As another part of this 11th membership standard, Ys across the country are required to develop a safety plan, again, per the MAHC, for their aquatic operations per facility. This safety plan has to be approved by the local board of directors, and then there's an annual statement that must be made to YUSA supporting this development of the safety plan. To help with this, because we realize that the safety plan can be a bit of a nebulous thing and difficult to develop, especially for more inexperienced aquatics professionals, YUSA created a template that Ys can download and follow. So as we look at different challenges and how we implement this MAHC usage, we've seen some really interesting nuance in this adoption. So when we look at nationally adopting the MAHC within YUSA and YMCAs, it only really applies this standard to follow the MAHC to two states, again, Mississippi and Alabama. YUSA and the 11th membership standard is essentially silent on states that have less stringent and less comprehensive codes. Technically, this standard does not apply to those states. However, for some of these, example, Louisiana and Arkansas, again, in my particular region of the country, the codes that are there, that are existing, are definitely not as comprehensive and not as well developed as the MAHC, and in some cases, years or decades old. Another problem with implementing the MAHC nationally from the YMCA standpoint is that, again, in Alabama, we have two counties, Jefferson County and Baldwin County, that have established bather codes for their pools. So the question is, where's the conflict? The state technically does not have bather codes. However, these two counties do. So there's some inconsistency in their application that YUSA has not necessarily found a good workaround yet. When we look at implementing the MAHC regionally, there's a lot of, here's where we run across the biggest problems. One is the sheer size of the MAHC. I've had conversation after conversation with local CEOs, with local aquatics directors, that they pull the MAHC out and they look at this extremely massive, extremely comprehensive document, and they become immediately overwhelmed. There's a feeling of difficulty in following it because they look at this and we see terms that they're unfamiliar with. They see definitions they're unfamiliar with. They see a lot of the technical detail in design and construction, and automatically this makes individuals very, very nervous. Our Ys across the country, but especially in our region, are wonderful facilities that do a lot of good work. But we're known for running programs. We're known for opportunity, and a lot of times trying to weed through code language is not our strong suit. Another challenge is regionally, there's a lack of knowledge for builders and pool operators and service companies. So in Mississippi specifically, we don't have that many true commercial aquatic facilities. We have approximately 20 to 30 year-round pools. We have a handful of water parks, but we just don't have the demand, or at least the facilities rather, for commercial pool operations, commercial builders to thrive. So when we look as a YMCA at having to do substantial alterations and renovations, oftentimes we're having to take the MAHC, which we're bound to, and walk through these builders and service companies to make sure that we're having these standards and this code applied properly. And of course, the big challenge there is when you have a builder and a service professional that is not familiar with the MAHC, combined with a staff at a local YMCA that is not familiar with the MAHC, that can lead to a lot of confusion, and sometimes things just don't get done properly. So again, other challenges are the gap in technical knowledge and how we apply this by the local staff. YMCAs are known for having a good bit of turnover, especially in entry-level positions, which in most places aquatics is considered an entry-level position. And we are not necessarily having a lot of applicants, and this is true in the aquatics industry as a whole, I believe. We're not having tons of applicants that come in with an existing background in aquatic operations and specifically code compliance. We have a lot of great staff that have been lifeguards and have taught swimming and coached swimming, but that level of technical knowledge is another area that we're struggling with. Another challenge is simply the lack of a state and county structure. We have no inspectors that we can turn to. We have no departments other than the standing building department that we can turn to for advice on code compliance, water quality, filtration standards. We don't have that structure in place. So that makes applying the code and following the code and following the MAHC even more difficult in our region. And then finally, just a lack of a reliable support structure. Again, we have really, really good Ys. We have a lot of really good staff, but most of us are running 90-0. We have multiple hats that we wear. In some cases, the fitness director is charged with running the outdoor pool, and that's the only aquatic facility that Y has. So we have those challenges and just a lack of connectivity. Most Ys are spread out over a very large geographical area in our region, and we only have a handful of really large associations. And again, that staff is very busy with programming and trying to run pools. So we lack a really, really good support structure. We have one in place, but it's still, the functionality of it is limited to say the least. So how are we as a YMCA and as a region looking at trying to improve how we apply the MAHC? The first is we are looking at creating some educational sessions that can help the local Y aquatic staff understand the MAHC more, apply the MAHC more, be less afraid of interacting with the MAHC, and demystify it to a certain degree. We also have a vehicle called YPN, Y Professional Network. And just so you know, there are YPNs all across the country that with the network, it's a substructure that does provide some peer-to-peer support. It is, the formality of it will depend on where you're at and what part of the country, but by and large, it is a self-regulated mechanism. We are going to look at creating peer-to-peer inspections and accountability mechanisms, peer-to-peer interactions to where we can work with each other to go out to other pools and each other's pools, and then provide assessments and those type tools to help with MAHC implementation. This is going to take a long time to work out as turnover is still a very real issue. Maintaining proper list of staff is a very real issue. And logistically, just trying to find the time for others to create this culture of this peer-to-peer inspections and utilizing the MAC as we're required to help with this process. And then we're also going to look at leveraging our power collectively as a Y, not only as the largest operator of swimming pools in the United States collectively, but also a major nonprofit. One of our areas of impact is in social responsibility. So leveraging our tools and our staff and our collective presence to work with states and local municipalities, local governments on adopting the MAC, either in whole or in part. This is another particular area that will be some difficulty in the years to come. Just my personal story. I've been a MAC advocate ever since the very beginning. I served on the first edition under on the Lifeguarding and Bather Supervision Technical Committee. I served on the third edition in the Technical Review Committee, and I've been promoting the MAC in my aquatic circles and my interactions on a very regular basis ever since. So part of the problem we deal with is roadblocks. So again, back to my particular story, I was reaching out, again, trying to leverage the WISE social responsibility focus on communicating with our state on developing and adopting the MAC. And the state legislature, the state representative I was trying to deal with at the time was all excited to chat with me as a constituent until he found out what it was for. And then he basically, I was persona non grata, and he ceased all communications and all interactions. So we still have some very real issues with the state on adopting regulation and being open to adding regulation to our state laws. And Mississippi specifically is notorious for being anti-regulation. So those are some basic things and areas that we're looking at trying to improve the MAC as far as for YMCAs and implement the MAC into our local Ys. So with all that being said, we acknowledge that there are many, many challenges to incorporating the MAC, but also just with YMCAs as a whole, that can be challenging. And it's also not just Ys, it's going to be Parks and Rec, smaller centers, smaller facilities. But again, I'm coming from a Y standpoint. So how can you, as a public health official, support your local Y? You know, the big thing is work on establishing relationships, and by and large, public health is very good about that. You're very good about making connections with your local pools. You're very good about serving as a resource and being there in the interest of public health. But especially with the local Y, recognize that the relationships may need to be a little bit stronger, a little bit more important there. Understand that in many cases, this particular person that you're interacting with, this aquatic staff member, may not have a huge aquatics background. They may not have one at all. It may be someone that has a kinesiology background, exercise science degree, that has never served as a lifeguard, or if they have, it was 10 years ago when they were in high school. So recognizing that in many cases, these individuals would have a very low-level background or a minimal one, to say the least, if one is present. There are some Ys that have large associations. Charlotte, I think of. Dallas, I think of. New York, I think of. New York City, at least, that employ association aquatics directors, which can work to bring up and fill gaps left at the lower staff levels. So there is that. Also remember that when we're talking about our staff, remember that most Ys tend to be programming focused, heavy on programming, and we struggle to keep our pool staffed. we're not immune from the lifeguard shortage that has plagued the aquatics industry for the last 20 some odd years. Some Ys are better than others. Some have found strategies that can overcome these challenges, but by and large, it's an issue we still struggle with. So when we look at these detailed challenges of filling in lifeguarding gaps, actually sitting on the lifeguard chair, actually teaching lessons, trying to staff, trying to work with budgets, that sometimes these little small code details, for example, in the MAC, there's a requirement that interlocks for computer controllers are checked on a monthly basis. They may miss that. So please keep that in mind and maybe have a little bit more patience. And obviously, Ys need to adhere to the MAC. They need to adhere to the code as well, and your local code. But just a little bit more patience with them as they have various struggles on a daily basis they have to deal with. And then we've talked earlier about how some Ys do have association leadership. Those may actually be your contact people versus the day-to-day aquatics directors and aquatic management staff. But absence of those association staff, you definitely have to take on a more educational role in developing these local aquatic staff for YMCAs. So at that point, I'm through with my rambling. So I'll turn it over to Desi and open the floor for questions.
Hi, thank you so much, Dewey, for your presentation. We do have a question in our Q&A box. For those who join us, please feel free to submit questions either via our chat box or our Q&A box. Unfortunately, you cannot ask questions via the telephone, but feel free to write those questions and we will be addressing them in Asking Dewey. So the first question for you, Dewey, just to clarify, the state of Mississippi doesn't require the MAC, neither does Alabama, but YMCA in Alabama and Mississippi are beginning to follow the code, like adapting the MAC has a YMCA policy?
It's so correct. As state entities, we do not have any codes whatsoever. Mississippi is a little bit interesting in that the State Department of Health does reference the code on its state website, which in my opinion, as an aquatics professional, makes it the de facto code. However, it's not adopted by state legislature. When we talk about YMCA's adopting the policy, that is not their choice. The decision was made by YMCA of the USA as part of the requirements to be associated and affiliated with the Y, that these two states must follow the MAC. So it's not a question of adopting the policy. It is there. We're required to by YUSA, our governing body, and they must.
Thank you, Dewey. We received one more question here in our chat box. Is what you presented applicable to all the Ys nationwide?
It is applicable to the states that do not have bathing codes. And this is where, again, we have maybe some inconsistencies and challenges. So we identified Mississippi and Alabama as having no code whatsoever, but there are other states with very minimal codes that are weak and outdated. So there is some, I don't say discussion, but there is an interesting nuance there that for these areas with less substantial codes, with YUSA requiring the MAC for these two states, does that still apply to them? That is very much a gray area that is not addressed. And my answer to those local Ys are follow the MAC.
Thank you, Dewey. The next question is there any affiliation between YUSA and YMCA Canada?
There's a loose affiliation, but it is not it's more of a peer. It is not necessarily a direct connection where one is working hand in hand with the other. Very similar to YMCAs across the world. We all fall under this YMCA banner, and that's getting a little bit outside of my depth, as a lot of those otherwise are less about programming and more about social interaction, social justice, education. But there is a loose connection, at least.
So our next question, Dewey, has the MAHC been referenced or used to assist with opening new Y facilities? And if so, how has the MAHC been utilized?
For opening new facilities, that is a good question. I honestly don't have an answer for that. Part of the problem is all Ys function independently. I know that in Mississippi and Alabama, we have not built any new facilities since the 11th membership standard was adopted back in 2017. So locally, can't really answer that. I do know that there have been plenty of Y pools that have opened up across the country. But again, with each Y operating independently, we currently don't have any mechanisms in place to gather that data. We could do some really loose surveys, but that is probably not going to be as reliable as we would like. So that's a very good question that we honestly don't have data for.
Thank you, Dewey. Next question asks, have you created educational session materials on the MAHC? If so, would you be willing to share? My pool program is beginning a stakeholder meetings on MAHC adoption, and we will need to educate our pool operators in a concise and informative way without intimidating them. Have you guys created anything on the YMCA front?
We have not. It is on our list to do, specifically for my two states. And also switching over to my CMAQ hat for a second, it's on our list to do as well for CMAQ. But we have not gotten to that point with either organization as of yet. It's been a long-standing project to work on for Mississippi and Alabama for our YPN network. Also, please reach out to me as well. Again, switching over to my CMAQ hat, I would love to carry on that conversation with you more.
Thank you, Dewey. Yes, I will also compliment Alton. Thanks for asking that question. I would also recommend you to go to the CDC's MAHC website. They have a lot of great resources there that you might be able to use in your stakeholder meetings. And also, besides follow up with Dewey, feel free to follow up with us as well. I will add our contact information here on the chat box, because we'll be happy to connect you to our contacts at CDC as well to see what materials they have to provide. So thank you. So our next question for you, Dewey, is the YUSA Aquatic Safety Guidelines available online?
It is through the YMCA intranet. So the YMCA has a web-based platform called Link, and it can be downloaded from there. You do have to have password access. But again, if you'll reach out to me, I will be more than happy to forward anyone on this call those aquatic safety guidelines. It is not a private document. It can be shared with anyone. So I'll be more than happy to do that if you'll just reach out to me.
Thank you, Dewey. The next question asks, how long was the process of adopting and implementing of the MAHC at your YMCA?
For my specific YMCA, it was very easy. So again, I've been aware of the MAHC and for a very long time, and I've been taking steps with each edition to incorporate the MAHC. For example, when the third edition came out, for me to work on incorporating the MAHC into operations, it basically took about an hour of sorting through the new changes, and then a little bit longer creating policy changes and document changes to support those. But all in all, I've got maybe, for my YMCAs, I've got maybe 5 hours in updating to the MAHC third edition from beginning to end, including document creation, postings, and things of that nature. Again, excluding some things that will require substantial alteration. So those parts excluded. I will say that, and again, this is just my opinion, any pool operator who is knowledgeable and high functioning should already be aware of the MAHC. And they should already be aware of the impact that it's going to have on the industry and is having on the industry, and should already be taking steps to incorporate, where appropriate, those sections into operations. I know that's a bold statement. I would dare say it's also a true statement. But again, we fall back to the problem of turnover tends to be very, very high in not only YMCAs, but in aquatics, period, across the country. So that is definitely an area that we as an industry need room for improvement in.
Thank you, Dewey. The next question asks, does the 11th membership standard apply to all Ys?
Yes, it does. So again, in the 11th membership standard, there are 3 different components. Component number 1 is for states that don't have an adopted code to follow the MAHC. Component number 2 is to have lifeguards on duty at any time the pool is open. That applies to all YMCAs operating under the YUSA banner, from Anchorage, Alaska to Miami, Florida, to Maui, and all points in between. So if a Y, regardless of what the local code says, is opening a pool without lifeguards on duty, they were in violation of the 11th membership standard. Same thing with the aquatic safety plan. And again, when we developed the template, we basically took what was stated in the MAHC and created an easy to follow template form. All Ys are required to have that created, maintained, and a supporting statement sent into YUSA. So that applies, again, Miami to Maui to Anchorage and all points in between to all YMCAs.
Thank you, Dewey. The next question asks, does the National YMCA have pool design guidelines? For example, the old BFS guidelines, do they have pool operation guidelines?
No, we don't. The only thing we have is the aquatic safety guidelines, and in those guidelines, and I have to be honest, I'm not remembering what BFF refers to in this context. But with the guidelines, aquatic safety guidelines, we're referring and deferring to local code where appropriate. And the rationale for that was quite simply, we would have created a massive, massive, massive document that was intended to be guidelines and best practices, not necessarily mandated. So we have a lot of deference to the local code built into the safety guidelines.
Thank you so much, Dewey. And then the next question asks if did the YMCA in Southern Mississippi use any pool codes or other safety resources before the MAC?
No, we used, and again, I can't speak for everyone, but just as an aggregate, giving some insight, it was a hodgepodge. So for example, I followed the MAC and used that as our default code even before the standard was released. Otherwise, not so much. And then some would follow recommendations from different consultants and different organizations, but we didn't have any one thing that we looked for. I mentioned earlier that state of Mississippi references the MAC on their website. We've had a trifold, again, not adopted by state legislature, but just a trifold developed by the state that dates back to the early to mid 90s and is quite dated. But that has been the only state guidelines that we have even had. And again, it wasn't even codified, it was just a trifold. So largely, and honestly, largely what's been going on with our local WISE has been more driven by insurance and insurance coming in and doing inspections than necessarily any other governing body.
Thank you so much, Dewey. Is there any other questions? There's one question here related to local governments that I would address in a minute, but before we move on to that, just want to open one last opportunity for everyone to submit their questions via the Q&A box in the chat. We received great questions so far. Okay, there's one question here asking, in Dewey, this might not necessarily be related to you, but you might know about this. And Christy from CMAC, I don't know if you are still online with us, but maybe you also have information on this. But do you have any updates on MAC inspector trainings? I believe NEHA created a pilot program around May of 2019.
No updates other than that is on our radar to get going. So switching over to my technical director hat, there are many things that we're looking to do with CMAC that are educational in manner. One is creating a webinar series that can be used for continuing education units and training. And we are talking about creating a formal MAC-based inspector training. That is very, 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 very early. That will not be this year, but it is on our radar to do in the next coming, hopefully within the next 2 years, to have that inspector-based training, MAC inspector-based training in place.
Thank you, Dewey. Let me just check here, make sure we haven't received any other additional questions. Dewey, we have one more question here related to opening new YMCA facilities. Just to complement the answer you had earlier, I don't know if you have anything else to add, but has the MAC been referenced or used to assist with opening new YMCA facilities? And if so, how has the MAC been utilized?
Um, Again, we don't have a lot of collective data for that. So I'm giving kind of a educated guess on this particular answer. Basically, all the pool designers out there, whether you're talking about the major industry players that design most of the pools, Grow Development is a firm that YUSA uses. That they all look and reference the MAHC in their design and construction practices. That's a bold statement to say. I'd be very surprised to find out if that wasn't true, at least in a majority aspect. So any references would be local based on the knowledge of the aquatic staff, the CEO, and the designer of the pool for its construction and opening practices. And it's aggravating for me and also for YUSA to not have answers for those and have to give educated guesses. But that is one gap that we have in just data collection, where we either don't have the focus for that, or in many cases, we are wearing too many hats and can't make that kind of data collection a priority over drowning prevention and running programs. At YUSA, we only have one staff member that is responsible for aquatics, one full-time staff member, and that individual is responsible for aquatic safety, for programming, for connectivity between aquatic leaders, lots and lots of different tasks. So we just don't have the structure to collect that kind of specific data.
Thank you, Dewey. We have some additional questions coming in here in our Q&A.
Sure.
So, okay, so one question, they appreciate your perspective on Y operation. It explains why we often find our local Y facilities lacking in good aquatic operations. So I think it's more a comment to you rather than a question.
Sure. And I hate that that's the case. I really do. I wish that we had nothing but fully competent and fully qualified individuals in these roles. And, you know, again, I want to say that we've got some great people. We have some great staff that care about aquatic operations, about swimming, about running things the right way. We just need some help. And we need some help from the inspectors on and the public health folks on maybe guiding them a little bit more.
Thank you so much, Dewey. The next question is not particularly related to the why, but you might know a little bit about this, and I would be happy to complement as well. But one of our attendees is asking, do you have any advice for a county health regulator who is involved in the state of Colorado MAHC adoption process?
Other than patience, the big thing is to reinforce that the MAHC is massively based on science and best practices. When we have science all throughout the MAHC, there certainly is some industry influence, but I can say this comfortably, having with my service I provided to the MAHC and in my involvement, that I have yet to run across anyone involved in creating the MAHC that is looking at it from purely their own personal perspective and their best interest. So when we talk about public health, the MAHC is 100% absolutely based on what is best for public health with an order of priority of what does the science say, and outside of science, what are considered best practices. That's one reason why it is so comprehensive, is that we're trying to capture all of that data. The other thing to focus on MAC adoption is the states don't really have to do anything. It's there, it's complete. And not only is it complete, but also the states don't have to update it. All they have to do is adopt the code, and then, obviously there's the legal language to go into play, but then tie it to the CDC's MAC annual or triannual revision process. So from a state standpoint, this stuff's easy. We don't have to form expensive committees. The work is already done. It's high level work, and it's a living document. It's not going to be a state document or a document rather that is created and then isn't touched for 10, 20 years. We have the resources, we have the goal of making this a living document. So those are some of the talking points I would encourage to share with others as you're going through this process. It is complex, it is a lot, but the other thing is, as you are talking with others and they get hung up or worried about complexity, yes, it's a lot, but there are also individual sections. And the CDC and the CMAC have created and are creating also mini MACs to help ease some of those education standards or education processes rather. So that would be my focus and my recommendation as you talk with your peers, as you talk with other state officials or county officials on MAC adoption.
Thank you so much, Dewey. And Jeffrey, thanks for asking that question. Such a great question. And I know here at Nature, we're always trying to provide support. So if there's any support that you need or specific resources, I would say also feel free to reach out to us as well. I'll have our contact information at the end of the webinar. And we'll be happy to put you in touch and help you, support you through this process as well.
And I would also ditto that from my CMAC role, in that if you're looking at having these conversations, I will be more than happy as technical director to call in, to remote in, whatever I need to do to help support you and everyone in the process of either full or partial adoption of the MAC, whether it be to maybe demystify things, give a little bit more technical expertise. In that role, I am there for y'all and for the entire country.
Thank you, Dewey. I think that concludes the questions that we had here. There's one last question that I'll be happy to answer that. So someone asked, would you happen to know how many local governments have adopted MAC so far? So, we know that CDC is working on looking into that. There are some information that they have shared in their website. We just put a link here for those who are interested to see. We do know that they're updating this, so this might not reflect all the states that have MAC adoption so far, but this information is at a state level. We here at NACCHO, and I think this it's a great transition to my next announcement here. For those who are interested in understanding how local health departments are using or adopting the MAC. So I let me just give me 1 second here as I open my slides. Sorry, everybody. So related to the question that was just asked about MAHC adoption at the local level, at the end of last year, Nature just published a research brief. I have here some of the highlights for you and the link. I would recommend everyone on this webinar to please go look at our report. It was a qualitative study. We interview local health departments across the nation. So it's not, national representative data, but just to get an idea of how local health departments are using the MAHC or updating their pool codes. I would say these are just some of our highlights of this report. Similar to what Dewey just shared with all of us, we find out by speaking with local health departments that there's a big range on how often local pool codes are updated. The authority, most of the cases across the U.S. fall upon the state, but with competing interests or time to update pool codes that end up sometimes falling through the cracks. So there is a lot of barriers identified by local health departments in updating pool codes, competing interests from stakeholders and partners, prioritization of other public health policies, and also the time and effort and cost associated with updating pool codes. Some of the catalysts on pushing those to update pool codes a lot of times falls into public pressure, either after a water-related injury or drowning, unfortunately, or that state-level commitment to update the codes. Regarding using of the MAHC at the local level, what we heard is that there is a big range, but we would say that a lot of the local agencies are using the MAHC, as Dewey was saying, really has a guideline, an evidence-based guideline that really is heavy on that science and provide them that science-based information. It's it's updated frequently. However, as also Dewey mentioned, there are challenges specifically to the comprehensiveness of the MAHC. So we also heard that through our report as well. So if you want to read more, please do access this report online and feel free to contact us if you have any questions. But we are trying to understand a little more how this is happening at the local level. And if you have stories to share with us, we'd love to hear how you also in your jurisdiction is either implementing the MAHC or looking for implementing the MAHC and updating your pool codes. With that, just have some final announcements before we close today's webinar. As you can see here, we have several great conferences coming up this year. As Christy mentioned earlier, the Association of Aquatic Professionals are meeting on February 17th to the 20th on Frisco, Texas. We have the Nature 360 conference. It's one of the biggest conferences organized by Nature. If you haven't participated or don't know more, I would recommend you to go on our website. This year we'll be in Denver, Colorado on July 7th through the 9th, and registration will open very soon. And also put it on your calendars, the World Aquatic Health Conference is happening again this year in Williamsburg, Virginia in October. and registration will open April 1st, so very soon as well. If you want to learn more about the Model Aquatic Health Code, we strongly recommend you to join our network. Please visit our website. I would say recommend everyone to please visit our website and make sure your contact information is kept up to date. We're changing our communication and listservs here, so make sure you go online and just double check, if we have your contact information so that you can continue receiving announcements and information about our upcoming opportunities for the network. And also our email address is here, and if you have any questions, any follow-up questions, please feel free to contact us. And with that, I just want to thank our guest speaker, Dewey. Thank you so much for participating in our webinar today. And thank you so much for all of those who join us. And we look forward to seeing you in our next webinar. Thank you so much.
Thank you.